Welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. In this segment, we're going to be speaking with Pamela Bishop, Chief Marketing Officer at Blooms The Chemist. Blooms The Chemist is Australia's leading community pharmacy. She's joining us on the program to talk about the recent white paper detailing its response to the COVID-19 pandemic. It's entitled Lessons Learned from the Frontline of a Health Emergency. She's also going to speak with us a bit about their brand strategy there at Blooms The Chemist. Welcome to Health Professional Radio, Pamela Bishop.
Hi, Neil. Thanks for having me.
Thanks for joining. Well, give our listeners a brief insight into what it is that you do and talk about your role there at Blooms The Chemist.
Yeah, hi, I'm Pamela Bishop. I am Chief Marketing Officer at Blooms The Chemist. So I lead the Marketing and Communications Department. Blooms The Chemist is a community pharmacy brand in Australia. We've got 100 pharmacies across communities in Australia, and we're very much focused on delivering better health outcomes for Australians.
Did your organization recently produce a white paper?
Yes, we have just recently published the white paper, which discusses our key learnings from working through this pandemic. I think, there's no denying that the healthcare industry, particularly those on the front line, such as pharmacies, have faced many challenges in recent times. So the white paper for us, it was an opportunity to reflect on some of those challenges that we've worked through and some of the learnings that we'll take forward as a business as well.
You talked about challenges that this pandemic has given us. How did you determine which challenges to look into as far as this white paper is concerned?
I guess we reflected back on what the major challenges had been for us as a business, and some of them very much, we're not through COVID-19 yet, so it's very much continuing. But our number one priority throughout this pandemic has been to ensure the safety of our people, and that is our staff and customers. There is a risk of infection, so these risks and the challenges were mitigated with conservative strategies. Some things that we did included splitting the rostering for the pharmacy teams and offering home delivery for customers and encouraging customers to stay home and stay safe, and that we would bring their medicines to them. Another major challenge that's discussed in the white paper is the focus we needed to put on managing the supply of medicines during the surge in demand that we've seen. We achieved that with a management plan for product shortages and by carefully monitoring the demand and supply during this period. Ensuring the continued supply of medicines to our customers is absolutely critical for us as a business, and that's what pharmacy is all about, of course. So, there have been some challenges. There's also been a number of changes in the industry, and, changes such as prescribing and dispensing regulations, needing to put limits on medicine purchases to prevent stockpiling. A number of e-health initiatives were set up and rolled out during this time, which I actually think is one of the best things to come out of COVID-19, because we've seen the speed, which is now enabling easier access to medicines. And for Blooms The Chemist as a brand, during COVID-19, we've actually seen our digital evolution rapidly advance within a space of weeks. Our pharmacists have really embraced the new technologies. We know that e-health is the future, and really it's here now. And I think in the current climate with the pandemic, e-health allows us to minimise physical contact. So it is actually making it safer for the community and, of course, our people on the front line as well. So look, lots of different challenges. And I think one of the other major ones, particularly from my department, was just the sheer volume of information, particularly back in March when it really hit us first here in Australia. There was a lot of misinformation circulating and just a huge volume of information coming out every day. So it was essential for us to put in place a communication system which allowed our support office to communicate every day to our pharmacies in the brand, and then for the pharmacies to also feed back what was happening on the front line. So that was something we did quite early on, which proved to be vital for us.
When it comes to learning, how much of the lessons do you think will become standard practice as we train our up-and-coming pharmacists to continue to embrace this technology and these new regulations going forward after the pandemic?
Yeah, it's such a good point. And we're actually doing a lot more virtually now as well. Tools that were in existence prior to COVID-19, Zoom is a great example. We didn't use that as a business, but now we're using it very regularly. So we've actually been having weekly meetings on Zoom, one for our pharmacists and one for our retail managers. And that's been a great way to keep everyone connected and making sure they feel well informed and really well supported through this time. And, it gives them an opportunity to jump on and chat with their peers and share their challenges and ideas as well. So it's been a really good tool that we've used. And absolutely, I think that's one learning that will continue for us as a business. I think a lot more of our training will be done virtually. We've got people from all over Australia, and typically what would have happened in the past is they would fly into one location for a day. And I think some of these new technologies and using the virtual settings will definitely continue for us, and it will just make it easier and more convenient for everyone. The rise of e-health is absolutely a big one, as well as home deliveries and transparent communications, both internally and externally to our customers. They are all areas where I think our business has improved drastically through the pandemic, and they will all be here to stay well into the future as well. And absolutely, the rise of e-health, it's a lot of things have changed in such a short time. So for new pharmacists coming out of uni, it'll be really key that they're across how e-health works and that it is the future and how it's actually going to make things a lot more convenient for the customer. Mm-hmm. So I'm hoping that as we move forward, we will take a lot of the lessons we've learned onwards with us as a business. Our business, Blooms The Chemist, have been brought together like never before. Everyone's working to a common purpose. I feel our business is a lot more aligned and united now as we move forward. And, it's been a challenge, but we're getting through this. And I think we're going to come out the other side a much better team and a more resilient organisation as well. And at the end of the day, it will just be about staying true to our brand, Blooms The Chemist. It's a caring and customer-centric community pharmacy brand. Mm-hmm. And I'm really proud that we haven't lost that as well, despite all of the stress and challenges that have come our way.
As Chief Marketing Officer there at Blooms The Chemist, are you raising awareness as to the importance of customer or patient adherence to their medications from a pharmacist standpoint? You mentioned customer-centered business. What are you doing in that area?
So in that area, in terms of adherence to medicines, we are actually working to ensure our systems are in place to offer an integrated and consistent experience for the customer. So as we move forward and further down the track with e-health, we will be fully integrated with e-health specialists. So, for example, right now already our Blooms The Chemist loyalty card is deeply integrated with MedAdvisor, which is the state-of-art software which actually helps customers to take their medication properly and safely and on time for effectiveness. So we'll be doing a lot more of that, and absolutely I think pharmacists have a key role to play in the community to educate their customers and making sure that people are compliant with their medication to get the best health outcomes. During COVID-19, our marketing department had to adapt in such a short space of time. Like every other business around the world, we had all of our marketing activities booked and locked in, and it was really a case of reviewing and adjusting all of our plans. So it was all hands on deck in the marketing team. We changed all of our planned marketing activities, and we really switched our messaging away from our typical product promotion that was booked in, and pivoted the messaging to make it a lot more of a communications effort focused on keeping our customers well informed, making sure that we were educating our customers about COVID-19 hygiene hacks and social distancing, making sure they felt that they had a trusted and safe environment when they did enter our pharmacies. So we were communicating all of the things we were doing, all the steps and measures we were taking in the pharmacies to make sure that we were limiting any risks as well. So it really was a 360, turn away from that product focus to much more of an educational focus to the customers. And we also did promote some proactive health measures, such as flu vaccines, and encouraging our customers, particularly the elderly and vulnerable in the community, to stay home. And we offered to bring the medicine to their doors instead.
Is there anything else, or maybe some place online that we can go and learn some more about Blooms The Chemist?
Yeah, look, we actually have a link to the white paper on our website. So if you can definitely just visit bloomsthechemist.com.au. And we do have a link to the white paper on there, which is free to the public to read. And we hope that it does help spread some awareness on some of the key learnings that we found as a business in our industry, and hopefully other industries can benefit from that as well.
Pamela, thank you so much for joining us here on Health Professional Radio.
Thanks for having me, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Pamela Bishop, Chief Marketing Officer at Blooms The Chemist. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.